Hey folks, today I'm diving into a crucial topic: pediatric respiratory distress. This is a condition that can be quite alarming for both parents and healthcare providers. Understanding the main causes can be a game changer in saving young lives. Early recognition and intervention are key to managing these emergencies effectively. Let's break it down into 4 categories: upper airway, lower airway, lung tissue disorders, and disordered control of breathing. Each category has its own set of conditions and symptoms that we need to be aware of. First up, the upper airway. This is the part of the respiratory system that includes the nose, throat, and windpipe. Think of conditions like anaphylaxis, croup, foreign body aspiration, and angioedema. These can cause significant obstruction and require immediate attention. Anaphylaxis is a severe allergic reaction that can quickly close up the airway. It often requires the administration of epinephrine and emergency medical care. In croup, a para-influenza infection causes a narrowed upper airway, leading to that distinctive barking cough. This can often be managed with steroids and humidified air. Foreign body aspiration is when a child accidentally inhales something like a small toy or food, blocking the airway. This often requires urgent removal, sometimes through bronchoscopy. Angioedema, often linked to allergies or medication reactions, leads to swelling that can obstruct breathing. Antihistamines and steroids are commonly used treatments. Stridor, a high-pitched wheezing sound, is common in these cases. It indicates a significant obstruction in the upper airway. Next, we have the lower airway issues like asthma and bronchiolitis. These conditions affect the bronchi and bronchioles, the smaller airways in the lungs. Asthma is a chronic condition where the airways become inflamed and narrow, making it hard to breathe. Inhalers and other medications are often used to manage symptoms. Bronchiolitis, usually caused by a viral infection like RSV, inflames the small airways in the lungs. This condition is most common in infants and young children. Both conditions can cause wheezing and difficulty breathing, often requiring quick intervention. Oxygen therapy and nebulized treatments are commonly used. Moving on to lung tissue disorders, these are conditions that affect the lung parenchyma, the functional tissue of the lungs. Pneumonia and pulmonary edema are the big players here. Pneumonia is an infection that inflames the air sacs in the lungs, which may fill with fluid or pus, causing cough, fever, and difficulty breathing. Pneumonia can be caused by bacteria, viruses, or fungi, and treatment often involves antibiotics or antiviral medications. Pulmonary edema, on the other hand, involves fluid accumulation in the lungs, often due to heart problems or severe infections. Diuretics and other medications are used to manage this condition. Both conditions can compromise oxygen exchange and need prompt treatment. Monitoring and supportive care are crucial in these cases. Lastly, let's talk about disordered control of breathing. This category includes conditions that affect the brain's ability to regulate breathing. This includes increased intracranial pressure, neuromuscular diseases, and toxins or poisoning. These conditions can disrupt the normal respiratory patterns. Increased intracranial pressure, often due to head injuries or infections, can affect the brain's ability to regulate breathing. This requires immediate medical intervention to reduce the pressure. Neuromuscular diseases, like muscular dystrophy, weaken the muscles involved in breathing. Respiratory support and physical therapy are often needed. Toxins and poisoning, whether from ingested substances or environmental exposures, can disrupt normal respiratory patterns. Treatment involves removing the toxin and supportive care. In these cases, addressing the underlying cause is critical. Early diagnosis and treatment can make a significant difference in outcomes. Understanding these categories helps in quickly identifying the cause and taking appropriate action. This knowledge is essential for both healthcare providers and parents. Remember, always consult with a pediatric specialist when dealing with respiratory issues in children. Their expertise can guide you through the best course of action. For more in-depth information and certifications, visit affordableacls.com. Stay informed, stay prepared. Continuous education is key to staying ahead in medical emergencies. Thanks for watching and take care. Your awareness and prompt action can make all the difference in a child's life.